Ray, a John Maxwell certified leadership coach. Welcome to Life, Love, and Leadership, where we discuss everything pertaining to life, love, and leadership. Let's get started. Welcome to Life, Love, and Leadership. I'm Tom Ray, and joining with me on the line is Dr. John Blanchard, CEO of Salta Direct Primary Care. Doctor, can you say hello?
Well, hello, everybody, and Tom, it's great to be here with you today.
Awesome. I'm looking forward to this specific podcast. But before we start, we always kick off with an attitude of gratitude. And today, I'm thankful for my hair. Yeah, I'm thankful for my hair. You know, I was looking in the mirror today as I was getting ready, and I thought, man, I'm so thankful that I have a head of hair. Because there's some folks that I know that, have parted ways with their hair. And so I'm so thankful for mine. And I think I got it from my mom's side because my dad lost most of his hair early on in his life. So I'm thankful for that. So Dr. John, what are you thankful for today?
Well, just driving in this morning and just seeing the beautiful trees. I love this time of year and the transformation of the trees and the foliage, from the green still, the vibrant colors that we see. I mean, there aren't so many places in the country that you get to enjoy that transformation. And I was just so delighted to see that driving in this morning. And it really is, kind of the theme of what we're talking about today is transformation, transformation of the healthcare industry and what it takes to make that transformation happen.
First, let's kick this off and tell all of our listeners and viewers who Dr. John Blanchard is.
Sure. Well, I'm a physician by training, and my father passed away when I was 18. He had a medical illness back in 1988, and that medical illness brought us into the healthcare industry and into the healthcare system. I was 18 years old and experienced that system with him as he fought his cancer. And even then, again, but this was back in 1988, the healthcare system was very difficult to access, very difficult to navigate, very difficult to get the quality and the care that we felt that he desired or that he needed. And the care that we could get, unfortunately, our family couldn't afford. And as bad as that was back in 88, it's even worse now. We have a healthcare system that everybody needs and nobody can afford. We spend way more on healthcare than most other industrialized countries, and we get far less. The care is difficult to access, difficult to navigate. And then, of course, everybody is familiar with the rising costs of healthcare and how it's destroying not only household budgets, but municipality budgets, corporate budgets, government budgets, and federal budgets.
Absolutely. And especially in this economy that we're in, people will be more reluctant to even go to see a doctor because they know it'll be an additional bill on top of all the inflation that's going on around them in this season that we're in. And so that I know that's a challenge for a lot of people, a lot of Americans. And so, but you, especially in the state of Michigan, have brought a different system to most people, and one that I was not really aware of until I got to speak with your colleague, Dr. Tony.
Yeah. Well, after this experience with my dad, he passed away, unfortunately, and I went to Michigan State University and decided to become a different kind of doctor. One that got to know my patients, had a trusting relationship with my patients, and that could help them in their journey to attaining optimal health. I finished all of my training and became a doctor in private practice in 1999, and very quickly realized that the problem with the healthcare industry wasn't the healthcare professionals. It wasn't the doctors and nurses and others. It was the system itself. The system was purposely built to be inefficient, high cost, and low quality and low accessibility. You know, we do some extraordinary things in our healthcare system, some of the best in the world at complex surgeries, cancer treatment, those sort of things. But in terms of the care that actually matters, chronic care management, moving upstream from disease where we can help people engage them in the ownership of their own health and wellness and disease management, and creating habits of health, prevention, routine care for urgent care, and you know, in primary care. You know, we don't do all that very well. And so in 1999, when I started practicing, I realized that we could not build a new way of delivering primary care within the existing healthcare system. We had to build it outside of that paradigm. Because, Tom, what you have is a healthcare industry that is been purposely built for the past 80 years to drive profitability for the stakeholders. And those are the major stakeholders of the hospital systems, the insurance companies, the healthcare brokers, and the healthcare consultants. In some cases, you know, the healthcare providers like doctors, you know, who, you know, are you know, driving up the cost of care. And really, if you think about it, the payers of healthcare, you know, who pays for healthcare? It's the individual consumer. It's you and I, through our taxes and through our contributions to premiums and deductibles. And it's also the employers. You know, the employers pay the biggest part of the healthcare bill in our country. And by the way, it's a $3 trillion bill. That's with a T. $3 trillion. It's roughly 20% of gross domestic product. And the employers had no control over the supply or delivery of that care or the cost. It's like they're buying this enormous healthcare supply chain, and they manage every other part of their supply chains to the penny, but have had no control over healthcare. Well, that's all changing. And we realized back in 2000 that what we had to do was to begin working for the payers. And when I say the payer, again, I don't mean the insurance company. I mean the individual consumer, and I mean employers. And that we were at the very beginning back in 2000 of an employer-led healthcare revolution. You know, the employers, they're saying to the healthcare industry, you are wasting our money and we're done with it. So we're going to take control, and we're going to drive transformation in healthcare so that we make healthcare more accessible, more affordable, and more exceptional for everyone. And that's what we do. So it's called advanced high value direct primary care. And it's a concept where our doctors don't bill insurance. We are paid by the individual consumer, who pays a very affordable monthly membership fee, $90 per month for an adult, or the employer pays on behalf of their employee. And that usually ranges anywhere between $60 and $80, depending on the size of the company. And for that, the consumer or the employer, you know, they get unlimited primary care visits, all the chronic care needs that they need for diabetes, you know, diabetes management, chronic disease management, all of the urgent care access, 24/7 access to their doctor, all of the preventative care, the physicals. They can reach their doctor any time of day or night, 24/7. The visits are 30 to 50% of them are virtual, so the patient doesn't even have to leave their house or work to get the care that they need. The whole idea of direct primary care is to deliver the right care to the right people at the right time and place for the right cost. And our data shows that we're able to reduce the total cost of care by 20 to 40%.
Wow.
So just to put that in perspective, my company, Salta Direct Primary Care, we not only provide the direct primary care delivery system, but we do a lot of healthcare consulting and brokering to create a plan design that works with direct primary care. And what we're seeing in the industry with inflation is that companies today, next year, you can expect an 11 to 22% increase in your healthcare costs if
Wow.
you're a business owner or runner or own a business. And that's just not tenable.
No.
You know, it's bankrupting the budgets of private enterprise, and so we're the solution to those rising healthcare costs. We're the healthcare benefit that employees love, so it attracts and retains top talent for a company while at the same time lowering their total cost of care. And people have said that that's not possible. We're doing it every day. We have over 10,000 employees or 10,000 lives that we take care of in Michigan, and multiple companies ranging from small enterprises, small businesses with 2 employees to one with 6,000 employees.
Mm. You're really helping to change thinking and then change the way we do things. I think we've always been programmed to do medical the way we've always done it. We go and get some kind of insurance policy, and then we only go to see a doctor when we're sick. From what I'm hearing more and more from you, and even my opportunity to meet with Dr. Tony was to find out more of what Salta has to bring to consumers and how to change that dynamic that was going on, or actually a paradigm shift from what was to what could be or what is now, with what you have to offer.
Yeah, and the key word is change, right? I mean, that's what leadership is change management. And healthcare is in dire need of transformation and change. But like I said, there's a lot of powers that be that don't want to change. They're making their money off of maintaining the existing paradigm. And so the change has to be forced. It's not going to be given. And that's why the employers have the power to change that paradigm. And the old paradigm was, just like what you said, I have this insurance card, therefore I have access to good health care. Well, that's not true anymore. You might have insurance, but health insurance is not health care. That's what I do. Health insurance is an actuarial bet that something, catastrophic might happen financially. And so the leadership that has to be in place is the leadership to, first of all, help everyone understand that they should hate their current situation. If you're a household and you're looking at your budget, trying to figure out whether you should pay for medications or your healthcare premium contribution or deductibles, that's a problem. And, in fact, all new income growth for individual households has gone to pay for healthcare. In 2006, 6% of household income take-home pay went to paying for premium contributions, deductibles, and those sorts of things. Because of high deductible insurance plans, that's now 20%. So all new income growth for individuals, all your listeners out there, it's not going to pay for education or clothing or into a savings plan for retirement. It's going to pay for healthcare. And we should hate that situation. When employers get to talk with their broker and their broker comes in, they say, I have good news for you. Your healthcare costs, your premium costs, or if you're self-insured, your healthcare costs are going to only go up by 6%. And Blue Cross said initially it was going to, or Blue Cross or any insurance said, it's going to be 10%, but I negotiated them down to 6%. And everyone's supposed to celebrate about that. That's 2 to 3 times historic inflationary rate.
Yeah.
And we're supposed to be happy about that.
Oh.
If you're an individual consumer out there, your listeners, or you're a business owner or an employer, you should be outraged because we are spending way too much for healthcare and getting way too little.
Yeah.
And you know, and that's what we do. I mean, we look at all of the healthcare we can provide at Salta for people and what we charge. It's a fraction of the total cost of care. Now, how do we reduce the total cost of care? Well, by investing in primary care and investing in this advanced high value direct primary care model, we're able to, because of the accessibility that we're able to give people, we can keep them out of the more expensive parts of the health system. So we can keep them healthier, preventing hospitalizations. We can prevent rehospitalizations. We can prevent the need to go to the emergency room a lot of times, because if you look at the total cost of care, people are ending up in emergency rooms for primary care related conditions. You know, they're going to emergency rooms for bronchitis and, you know, UTIs and all sorts of conditions that can be treated effectively in the outpatient primary care setting. They're going to urgent cares, which are a more expensive setting than primary care. We reduce the need for unnecessary specialty visits. If you look at the specialty referral rates prior to 2010, they've gone up 200 to 300%. In other words, people are being referred to specialists 200 to 300% more than they were prior to 2010. Now, why is that? It's not because their conditions are more advanced or that they need to see a specialist. It's because the existing healthcare industry is paying primary care to see people every 10 to 15 minutes. Mm-hmm. They don't have the time or ability to manage their complex conditions themselves, and they're ending up having to just be a referral. And frankly, the hospitals love that.
Right.
Because they're feeding, that's why hospitals are buying up primary care offices, because they're feeding the hospitals more expensive healthcare lines. Mm. If the average consumer and employers actually understood how the healthcare industry is fleecing them, there would be a revolution. And that's what we're trying to uncover, to unveil, is that we can do healthcare with a lot more quality and better outcomes and accessibility and experience of care, while at the same time dramatically lowering the total cost of care.
That's awesome. You know, taking the time with the patient is so powerful, because you know, sometimes they feel rushed through the process, and like, you know, doc, I have some other things going on, but I'm not able to spend that time to talk with you because you got to move on to the next patient. And so what I've heard with the Salta model is that you only allow like 800 patients to register at a particular office. Is that correct?
Right. So in the traditional healthcare setting, where the traditional healthcare industry is going, is that the average primary care doctor has 2,400 patients. And then they're supposed to supervise 5 nurse practitioners or PAs who each have 2,500 patients. Now, we love nurse practitioners and PAs. They provide great care. But the reality is that they have only a fraction of the training that we as doctors have after a bachelor's degree. So they have 2 to 3 years. We have 7. Wow. And so we're able to manage more complex conditions longer. And in fact, in our Salta model, we have a 1-to-1 ratio. So if we have for every PA, we have a doctor, and the doctor supervises the PA's records, and they work together collaboratively to take care of the patient. But we go from 2,400 patients to 800. Instead of seeing 30 to 40 patients a day, our providers see no more than 14. So that we give more to each patient, and that's where the secret sauce is. It's forming a relationship with a high quality healthcare primary care provider. Every person should have a primary care provider, a PCP, that they trust and that they have access to. And, you know, the key is time with our patients. Time is the currency of excellence. If we're going to be excellent at anything in life, we have to spend time on it. And for a primary care provider, that means time with our patients. Time allows for communication, where we talk, we hear the patient, they tell us what's wrong. We give them as much time as they need. The average visits are 30 to 60 minutes in length. Physicals
Wow.
are 60 minutes. We have the time, we have the ability to communicate, and we have the passion for that relationship. We love our patients. And we know when we know that we win when we hear our patients say, "I love my doctor." You know, that's really our goal, is to provide an environment where people can go to for a well of hope, where they can be loved, where they can be taken care of. And there's only so many wells of hope in life, Tom. I mean, there's literacy, there's the love of family and friends. I think there's faith is an important well of hope. But primary care and healthcare should be a place where you go to for hope, because we're all facing life's challenges and difficulties, every single one of us. And it's a battle in life between hope and despair.
Mm-hmm.
And I'm telling you, after COVID, after being a doctor for 25 years, I have never seen so much despair among the population. The amount of mental health, depression, anxiety, loss of hope, despair, I mean, it's staggering.
Yeah.
And we introduced behavioral and mental health services right into our Salta delivery system. So every single one of our providers are coached in stress management, resiliency training to treat depression and anxiety right in the primary care level. So it truly is an advanced model of primary care. We're doing things that they're nowhere near doing in the traditional healthcare setting, because we purposely created a model to deliver that.
That's incredible. I just did a podcast a couple of weeks ago with Dr. Lisa H. Fuller. She is a counselor, psychiatrist, and she was talking about the whole mental health perspective that's going on, and how that need for care in mental health has risen. And I think more people are just being more honest with their fact that they've been dealing with it. They've been feeling a little more comfortable coming out of their shell and letting people know that they're struggling with mental health.
They are, and then they need an access point to get the care that they need. And I think, one of the things I want to leave with all of your listeners today is I want everyone out there to think about this question. Whether you're a business owner, or you run a business or company, or a large, small, or medium-sized enterprise, or you're an individual consumer, I want you to think about this question. What industry in the United States, what's the only industry that isn't subject to the consumer driving change? The only industry is healthcare. Every other industry, banking, finance, how we travel, how we get moved around, how we shop, all of that has been transformed by the consumer, right? But healthcare isn't, and that has to change. So it takes leadership. Leadership is about change management. You've got to hate your current situation. You've got to see a better vision, which we're providing, and then you got to take the first steps. When I meet with businesses, I don't monkey around, meeting with someone who isn't able to force change. And that's usually not the person in human resources, because, they don't have the power or the ability to make the change. And then usually they're working with a broker or healthcare consultant who either doesn't have the will or understanding to drive change. So the only time I meet with a company is when it's with a C-level person, a CEO, chief financial officer, chief operating officer. This is a decision that's made at the top of organizations, because it's about driving change in your organization. And the truth is, Tom, if companies don't do this, if they don't understand that they need to own and manage their healthcare business, I don't care if you're in the shoe business, whatever business you're in, if you're not in the healthcare business, you're going to be out of business. and that's just the truth, because The rising healthcare costs is absolutely devouring profitability and EBITDA. So companies are in a really bad situation that they think they have no solution for. They've got to provide a healthcare benefit that their employees love, while at the same time reducing the total cost of care. It seems like, there's no solution for that, and there isn't in the traditional setting,
Right.
but there is with Salta. We become the steward of your healthcare resources. We help you manage your healthcare business. If you're a business owner that has 100 employees, you're spending over $1 million a year on healthcare costs.
Wow.
We can save you 20 to 40% of that every year.
Wow.
By deploying direct primary care. And in private enterprise, it's all about EBITDA. Enterprise valuation is based on some multiple of EBITDA. So I want all those business owners out there to think about that. If I can drop $1 million of profitability or EBITDA to your bottom line, and your company is valued in the market at 10 times EBITDA, I just drove up enterprise value $10 million. If I drop $100,000 of EBITDA to your bottom line because of the healthcare cost savings, and you're a 10 times EBITDA company, I just dropped $1 million of valuation to your bottom line. And so smart CEOs realize they're not competing with each other just on their product or their service. They're competing with each other based on how they're managing their healthcare costs.
Mm-hmm.
And there's no solution in the traditional healthcare setting. Don't think you're going to go to your healthcare broker or consultant and they're going to solve this for you, because you know what? They work for the insurance company.
Right.
My dad always told me, he said, John, know who you work for. I said, well, how do you know who you work for? Look who's signing your checks. That's who you work for. And these healthcare consultants and brokers at these big firms, they work for the insurance company because that's who's paying them. They don't have your best interests in mind.
Yeah.
And that's why we don't do that. We work directly. We do all the healthcare consulting and brokering for our companies, as well as providing the provider solution. And the truth is, one of the best industries for this is healthcare. You've got large practice groups of doctors. You've got diagnostic centers, home healthcare agencies that have over 100 employees. If you're a business that has over 100 employees, you need to be thinking about moving to self-insured insurance. And then when you do that, become self-insured, you're transferring risk to yourself. So then you need to hire Salta to manage that risk exposure. That's the future.
That's the future. And you mentioned leadership, and everything rises and falls with leadership. And so if you're going to make change in a culture, say a business, for instance, the business culture, the way that's going to change is going to start from the leadership and from the top down.
Yep.
And that's what's going to make the difference.
Yeah, as CEO of my company, I have 3 jobs. The number one and the most important is setting the culture of the organization. It's culture first, then people, then process. And culture will eat people and process for dinner all day long. You've got to have the right culture. My number 2 job is driving top line revenue. And my number 3 job is driving enterprise value, which means driving up EBITDA and profitability, managing the company in a way that's fiscally responsible. And so any CEOs out there, any top leadership out there, those are really your top 3 jobs. And direct primary care allows you to hit 2 of those: setting the right culture, the culture of caring for your employees. And there's no better reward for work than giving your employees both healthcare security for them and their loved ones, and as well as financial security of them not having to spend more and more on their healthcare costs. That's setting a culture of caring for the employer, and then driving enterprise value. I mean, that's what we can do for companies.
That's wonderful. With the Salta model, the $90 a month, I believe you said, for adults, what will the consumer need more medical care coverage? for instance, something catastrophic, cancer, or
Yeah.
getting in an automobile accident or something of that nature?
Well,
What?
we always recommend that the individual consumer have a health insurance policy, right? Because that's what insurance is. Insurance should cover the rare catastrophic things that happen. In direct primary care, we can take care of a person's 80% of all their healthcare needs. So, all of their diabetes management, hypertension, chronic care, all of that for one low monthly fee. And then you should carry insurance for those rare, unexpected things that happen. Like if you need an expensive test and or go to the emergency room or hospital. But we also help steer people to value in the marketplace. So we've got arrangements with diagnostic centers and labs and those sort of things where we can get low cost care for people that are paying out of pocket. We have a lot of patients who they work for an employer who doesn't provide health insurance, and so they do just pay for, so at least they have access to a doctor to get the care that they need when they need it, and they don't have insurance. But we do recommend that people have that policy for the rare things that happen. This is also another solution for any business owner out there, food service, hairstylists, all of these businesses that have restaurants that have under 50 employees and they don't provide a health benefit because they can't afford it. Providing Salta as a benefit is a good option. It makes you, separates you from others to attract and retain top talent. You're essentially giving them access to a private doctor, and for $90 a month, you get a lot of value for that, and it's very sticky. Law firms, accounting firms, that want to differentiate themselves, they can provide this benefit as a standalone option for their employees.
It sounds like an answer to a problem that a lot of people didn't know that we had so much. And I say that because I don't know that a lot of people knew that the Salta model was available.
Yeah, well, we've been at this 20 years, and you're right, it hasn't. And it's really a frog in boiling water scenario that you're probably familiar with. If you put a frog in water and you heat it up quickly, it'll jump out. But if you heat it up slowly, it'll stay there until it's boiling and it dies. That's what, we're the boiling frogs. We've been in this paradigm so long, we don't know and appreciate how badly it's destroying this country. I mean, every dollar that we're spending of that $3 trillion is a dollar less that we have for social services for people that need it. Infrastructure, roads, education, defense, security, fire, police. I mean, this is the defining crisis of our day. Like when I look at my children, the biggest problem they're going to face is if this healthcare crisis continues of healthcare costs, because the country's not going to have money for spending on anything else because it's all going to healthcare.
Just getting that word out alone will be valuable information in the hands of those who didn't know that there was a better way. The old adage is we've always done it this way, and it's a broken system, and we know that one drives the other, and the costs stay high. And what you're offering to employees and consumers is the ability to now afford health care that really makes sense, and where the individual feels like they're really being heard and taken care of. And I think that will help even with people appreciating their employer for connecting them with a care such as this, where they're not only getting the care that they need, but they're also they feel like they're being valued, and they'll feel like they're being valued from their employer because they're being valued by their primary care.
That's right, and it'll keep them, more productive and at work and less likely to go down the road for another $1 an hour. The average cost for healthcare per employee is $13,000 now per year, $13,000 per year. And since the Affordable Care Act was passed after the last Great Recession, it allowed for companies to shift more costs to their employees. And that's what we've seen happen. That's how they've been dealing with this rising healthcare cost. But that's not a tenable option anymore, because the employees, high deductible HSAs, high deductible qualified health plans with HSAs, it works for your higher compensated, healthy, young employees because they can save money in there. But if you've got medical needs, or you don't have that high of a compensation, it doesn't work for you. The average rank and file employee can't afford a $6,000 to $12,000 deductible.
Right.
That's a bankruptcy. In fact, over 50% of all bankruptcies in our country, personal bankruptcies, happen because of a medical illness.
Mm.
And 50% of those that have bankruptcy from a medical illness had health care.
Mm.
They had health insurance. But see, the vast majority of us are living paycheck to paycheck, and we have less than $1,000 in the bank. So if you have a $6,000 deductible or a $10,000 deductible and you're in the hospital for 2 weeks for something, that's a personal bankruptcy.
That's a sober thought, isn't it?
Yeah, it's not tenable. It requires leadership. Every individual consumer out there needs to go find a direct primary care provider. We're the largest in the state of Michigan, but there's something like 30 of these practices now throughout the state. And every business owner and person who runs business, every leader in business needs to be moving in this direction. And that's going to send a very loud message to the stakeholders, the hospitals, the insurance companies, that, we're not tolerating this anymore.
Mm.
We want value for what we're spending our healthcare dollar on. And, and we expect change now.
I liked, you talked about the employer-led health care revolution.
Yep, that's what this is. It's the employers that are driving the transformation, because every other stakeholder, the individual consumers don't have the power. They can be part of the movement, but they don't have the power. It's only the employers that have the power to drive change and drive the change that the other stakeholders don't want to see. The hospitals, they don't want to see decreased hospitalizations. So, when I meet with hospital CEOs, the first thing I ask them is, are you in the business of keeping people in or out of the hospital? So we were purposely built from the ground up to transform the care that we provide in primary care to high value. That's why we call it high value, advanced, direct primary care. It's direct because we work directly for the consumer, the individual, and the employers.
With this healthcare revolution, what are you hoping that will take place in the future as we move forward?
Well, the reality is that Michigan is at least 7 years behind the rest of the country on this. So there's companies like mine that are national companies that are direct contracting for primary care, advanced primary care with employers. And the penetration of that is much higher in California, Colorado, the South, the East Coast. Michigan has been in sort of a healthcare bubble because we have one insurer that's dominating the market, that we have high penetration of unions, and they don't do change really well. And historically, we've had pretty good access to pretty good care. But all of that is changed since the recession. And our market here in Michigan is the way California and Colorado was in 2015. It's primed for transformation. And it has to, because we can't compete with spending as much as we are on healthcare. So the change is happening now. We've had more calls in the last 24 months than we've had in the previous 20 years from employers who, and not just employers, but municipalities. We have a meeting coming up with a large county municipality. they're in a budget crisis, which most municipalities are. Like their healthcare costs for their retirees and their current employees it's untenable. And so they need a real solution. They hate their current situation, so they call us. So anyone who hates their current situation, whether it's an individual consumer or an employer or a municipality, we're the solution.
How many branches do you have?
Well, we just opened our 7th office. You talked to Dr. Cordelio. That's our Shelby Township office. We're really excited to be in Macomb County. We think Macomb County is a great spot for us. We want to open 50 to 100 of these offices in the next 10 years. Healthcare is hyper-local, meaning most people see a primary care doctor within 5 miles of their home or their work. So we need one of these offices every 5 miles. We've got a large presence in Oakland County, both northern Oakland County and Clarkston, Midway and Auburn Hills, and then southern Oakland County and Troy. And then we have an office in Ann Arbor. But we intend to open 50 to 100 of these in the next 10 years.
Wow. I think that it's going to spread like wildfire, I would imagine.
Yeah, it absolutely is. And that's our mission. Our mission as an organization is to reinvent the financing and delivery of primary care. And our passion is the relationship with our patients. And we really do want to make healthcare more accessible and affordable and exceptional for everyone in our communities where we live and work, and particularly at-risk communities. So we're really excited about opening offices in Detroit and other places where, at-risk communities, as we saw it during COVID, it was the African-American community that just got absolutely devastated from COVID. And it was because they didn't have easy, affordable access to the care that they needed. And we need to change that.
That's great. So how can the employer get in contact with you or your organization?
Well, they can go to our website, saltadirect.com, and there's a contact in there. Kyle Bingham is our director of growth. And, it's really an educational process for us. When we meet with potential clients, where are your pain points? What are you trying to achieve? How can we solve your problems? We actually even do an impact analysis. So if you're a self-insured company, we take in all of your claims for the previous couple of years, and we can actually demonstrate to you, based on our historical performance, how much we can save you in healthcare costs. And we do that without a charge. So they can go to the website, or they can reach Kyle Bingham directly on his cell, 248-820-7705. Again, that's 248-820-7705. Anyone out there that wants to learn more, feel free to call Kyle. He's a passionate evangelist for transforming healthcare with our model.
That's wonderful. And speaking of evangelists, I was just speaking to my pastor about this model, and I know that there are many pastors who don't have any coverage, and/or the coverage that they have, that it's a big expense on the church, and even for them and their employees and their staff, and you have something to say about that?
Yeah, absolutely. I mean, we see a lot of movement among faith communities. Parishioners want their faith leader to be healthy. And so, there's a lot of movement in there.
Yeah. So the individual, if someone is interested in joining Salta, it's the same process. They go to salta.com, or?
Yeah, it's really easy for individuals. They can go to saltadirect.com, and there's a join now button. So you click that, and then you can pick your location, your doctor, and the only way you can register is with a credit card. So it's a simple, secure, safe onboarding mechanism where you register through our website with your credit card. There's no long-term contracts. It starts right away, and we start billing your credit card. And then when you're ready to cancel, you cancel, and we stop the billing. So it's very simple, very transparent. And that's what we need. We need healthcare cost transparency. Gone are the days where, you've got this high deductible plan, you go see your primary care doctor, and next thing you know, you've got thousands of dollars of bills, So, no surprise billing. It's one simple low monthly fee. It's like a gym membership. But you're essentially hiring a private doctor that's your companion to achieve optimal health in your life. And being able to, and it's particularly valuable for people that have, they're really busy, younger professionals that don't have the time to wait in a doctor's office for hours. It's good for people that have chronic, complex conditions. It's good for the elderly, elderly folks that they move slower, talk slower, think slower. They need more time and attention from us. So, those families out there that are caring for elderly parents, it's a great solution for them too.
Awesome. And so to be the devil's advocate for a moment with you, okay, I sign up with Salta, I'm paying $90 a month, and if I have to visit the office 3 times in 1 month, how much is that going to cost me?
Well, it's still the $90 a month. Yeah, so there's no, there's no more, no less. But what we find is that in the traditional healthcare setting, we average about 2 engagements a year. In the traditional setting, we average 6. So some people that have a lot of needs, we might see them every other week. Someone who doesn't, we see them for a comprehensive physical exam, and then we might see them a couple other times during the year. But the amount of time that they save just in not taking PTO time off work, or beginning to partner with us to get on a healthy diet or stop smoking, or we call them habits of health, implementing habits of health in your life to achieve optimal health. It's a holistic approach, and if you're young and healthy, it's a way to maintain that health. If you're not and you want to make change, then we're equipped to help you get there, with implementing these habits of health, getting on a healthy diet, exercise, mindfulness. It all starts up here, identifying your purpose and identifying as yourself as someone who's healthy and fit, not, unhealthy.
That's good. And so there's no copays, and there's
no copays, no deductibles. We do all the EKG testing in the office. Again, if you need care outside the office, we can help steer you to high value care, the best care at the lowest cost to save you money there. At one of our offices, we're dispensing medications in Clarkston. We're not doing that at Shelby yet, but we can dispense common medications at pennies compared to what people pay if they go to the pharmacy.
Awesome. And of course you do write prescriptions and all of those things as well for the local pharmacies.
Yep, sure. People are used to, with these high deductibles. I remember my wife always used to say, like, we got to, get to our deductible so that things get paid for. Really what we want to do is try to get all of our care in a low cost, advanced, high value direct primary care setting. In fact, I'm eating our own dog food. I provide this benefit for all my employees. In fact, I have a direct primary care doctor, and so does my family. It's Tony Cardelio, Dr. Cardelio in Shelby. Yeah. So, if you think about it, it's like your car insurance. You don't pay for windshield wipers and brakes and those sort of things. You pay directly for those, and then you insure for car accidents. Yeah. That's what we want.
Do you have anything else to add to this very information-rich podcast today?
No, I think just to, again, emphasize that this is a consumer employer-led, healthcare revolution. We have the power to transform healthcare, but it's got to be led from employers. It's got to be top leadership at businesses and enterprises that drive this transformation. And that's an important part of getting to where we need to get in healthcare.
I thank you so much for being my guest on this podcast today. I consider it an honor to be able to connect with you and to hear your heart about direct primary care, and the fact that you just care about people and that you want to see them doing well and saving some money at the same time.
That's right.
Well, it's a pleasure having Dr. John Blanchard on the podcast. And if you'd like more information on Salta Direct, go to saltadirect.com, and there you'll find a way to register and or find out more information about how Salta Direct can benefit you and your family, or perhaps your business. And then I'd like to tell you, if you're ever interested in leadership, development, coaching, mentoring, or anything of that sort, feel free to contact me at tom@realleadershipcompany.com. I'm also a realtor, and if you're looking for a new place to hang your hat, perhaps your dream home, contact me also at TomReaRealtor@gmail.com, or call me at 586-275-7732. Doctor, once again, thank you for joining us. And thank you all, our listening and viewing audience, for joining us today on Life, Love, and Leadership.